Dr. Abhijatri Dutta. On behalf of Hers Academy, I welcome you all to this Mrcp PACES course. So, what we are going to start with is an overview of the entire PACES carousel system which happens right now. Now, before that, what do you understand by PACES? What does PACES mean? Anyone? P for practical, A for assessment of, C for clinical, E for examination, and S for skills. So what does it indicate? It indicates that the Royal College has already tested your theoretical knowledge as well as data interpretation skills when you cleared your part 1 and part 2 exam. So this exam will primarily focus on clinical skills. So over the next 2 to 3 days, all of us are going through several patients where we are going to see how to have a structured approach, be it related to physical assessment, identification of physical signs, communication, applying a differential diagnosis based on a case, and as well, very important, to address the patient concern as well as managing patient welfare. So this is now how the PACES runs. Now why it is a PACES 23 carousel even in the website? This is because this new format was introduced in the last diet of the year 2023. That is why it is called PACES 23 carousel. As you can see, there are 5 stations with 5-minute interval in each. So usually what happens, there are 6 candidates. One of the candidates will start with a rest station. But this is how the stations look like. The first one, 20 minutes, all of them you see are 20 minutes with 5 minutes interval in between. The first one is a communication station and respiratory. The next one is brief clinical concentration. You move on to cardiovascular neurology, then abdominal communication and consultation. You can start from any of the above stations. It's not mandatory that everyone is going to start from station 1. Some will start from station 1, some from 2, 3 and so on. Now this is basically all the skills which they are going to see, how you are approaching. Number 1, physical examination, a structured and a focused examination. Why? This is an exam where time is of utmost importance. As you know, there is a fixed time. So you have to complete the entire examination within that stipulated time period. Next is identifying physical signs. This is very important, and that is why practice is the only solution. In the clinical stations, I mean the respiratory, neurology, cardiology, gastroenterology, there will be obviously real patients for sure. So whether you are going to elicit the physical signs correctly is important. One tip I would like to give you, suppose you are not finding any abnormality, don't find an abnormality based on what you feel. Just point out what it is there. If you don't find any abnormality, fine. Next is clinical communication, how you are going to communicate with the patient. This is of most important in 2 stations. Number 1, obviously in the communication station and also in the brief clinical consultation. We have a talk on this, so we will elaborate on it on that talk. Next is, as I told you, a differential diagnosis, the clinical judgment, managing patient concern and patient welfare. This is very, very important. So these are basically all the stations and what are the skills they are being assessed in each and every station. As you can see in brief consultation, all the 7 skills are being tested. Now a brief outline on the communication station. What happens when you sit outside, you will get a scenario. So it could be based on anything, an aggrieved patient relative, could be breaking a bad news, could be related to brain death, organ donation, whatever is, read through the scenario thoroughly. Now in this new format, the communication has 10 minutes and there is no interaction with the examiner. Most of the time there will be a surrogate and not a real patient in a communication station. This is brief clinical consultation. This is putting it all together as we do it in an outdoor basis. We talk to the patient, take history, do a physical examination, explain the patient, possible investigations, how we are going to manage it. The entire time period is 20 minutes, 15 minutes for you, 5 minutes discussion with the examiner. And here also you are going to get a scenario. Read through the scenarios carefully and try to jot out the possible differential diagnosis which you have in mind, but have an open mind. There may be something else when you enter into the station. So this is the clinical system examination. So what are the components or the skills they are going to assess is written there. But what is important out here is whenever in a clinical station you enter, what happens in clinical station, you sit outside. There is no paper given to you. You enter a station, there will be a paper which will be hanging from the wall or somewhere where it will be written what is the problem. For example, this patient is having a shortness of breath. Please examine dash dash, could be chest, could be cardiovascular, whatever. So first read it. Obviously wash your hands, sanitize your hands, go to the patient, introduce yourself, identify the patient. For example, Mr. Allen, he will say, yes, I am so and so, I am the resident out here, I am going to examine your suppose cardiovascular system or the respiratory system. Is it okay with you? At any point of time, if you feel any pain or discomfort, do let me know. This is very important, right? And after that, before you go into the station, move 2 steps back and look into the surroundings. There could be patients where there is maybe a sputum cup there, could be oxygen attached, could be walking aids. These are important. And further to it, we will describe in the stations as we do. This is in fact the last slide. I have kept it because what is important, as you see, there are 2 rows. The first row shows communication, respiratory, consultation, cardiovascular, nervous system. That is all the systems you are going to cover in those 5 stations. And they have the total available marks and there is a pass mark. Now if you go below, these are the physical examination, the skills, the 7 skills, and see what is the total available marks and what is the total pass mark. In order to pass the exam, you have to pass both the encounters as well as the skill station. That is why it is important. Suppose you have done very well, but you haven't scored 14 in physical science, suppose 12, you are not going to pass. So that is why this is very important. Okay, any questions? I think this is more or less everyone knows, since everyone is preparing for the exam. It's just a small overview. Any questions? We can move over to the next.